In this video, we're going to talk about fluids. So let's talk about the role of carbon dioxide and hydrogen ion buffers. So these maintain a normal body pH. Um, so that's important for enzyme activity and cellular function. And the body relies on these buffer systems um, like the lungs and the kidneys. Carbon dioxide bicarbonate buffer system. Um, it's one of the most important extracellular buffer. Um, so the key reactions is carbon dioxide acts as an acid through carbonic acid, and then bicarbonate acts as a base. The increase of carbon dioxide increases hydrogen, which then decreases pH, making it more acidic. And then the decrease of carbon dioxide and a decrease in hydrogen then increases the pH, making it more alkaline. Regulation. So the lungs control carbon dioxide. It's a fast response. Hyperventilation decreases carbon dioxide, which then increases pH. Hypoventilation increases carbon dioxide, decreasing the pH. And then kidneys controlled bicarbonate. So it's a slow response and reabsorb or excrete bicarbonate and hydrogen. Hydrogen ion buffers. So there's protein buffers, phosphate buffer system, and hemoglobin buffering. So the first one we'll talk about is protein buffers. Hemoglobin is a major buffer in blood, and it binds hydrogen and helps transport carbon dioxide. And then phosphate buffer system, it's important cellularly, and it's in the kidneys. Hemoglobin buffering is deoxygenated hemoglobin binds the hydrogen more readily, and it helps maintain blood pH during oxygen delivery. Principal ions, concentration and regulation. Body fluids have electrolytes that influence osmotic balance, nerve function, and pH, and the pH. Regulation mechanisms for the kidneys, they control and excrete and or reabsorption of sodium, potassium, hydrogen, and bicarbonate. And they maintain long-term pH balance. And hormones, aldosterone, which increases sodium reabsorption and increases potassium excretion. Antidiuretic hormone controls the water balance, and then parathyroid hormone regulates calcium and phosphate. Cellular shifts, hydrogen and potassium exchange across cell membranes. Acidosis, that's potassium moving out of the cells, and then alkalosis is potassium that moves into the cells. Acid-base imbalances, effects and treatment. Acid-based disorders fall into respiratory or metabolic categories. Acidosis is respiratory acid. So respiratory acidosis caused by carbon dioxide retention and hypoventilation, like lung disease or airway obstruction. The effects are confusion and headaches and decreased CNS activity. Treatments would be to improve ventilation and treat underlying lung conditions. Metabolic acidosis, the causes or metabolic acidosis causes decreased bicarbonate or increased acid production, like diabetic, like like diabetic ketoacidosis, renal failure, or severe diarrhea. The effects are rapid breathing, fatigue, and shock in more severe cases. And treatments are IV fluids or bicarbonate. Alkalosis, respiratory alkalosis is caused by hyperventilation, which decreases carbon dioxide, like high anxiety and high altitude. The effects are dizziness and tingling, and a treatment for that would be slower breathing and just treating the underlying cause. And then metabolic alkalosis is caused by increased bicarbonate or loss of acid, like vomiting, which causes the loss of gastric acid, or even having excess of antacids. Um, the effects are muscle cramps and arrhythmias, and the treatments would be to replace fluids and electrolytes and treating the underlying causes. So overall, the carbon dioxide bicarbonate buffer system is central to pH control. Lungs and kidneys maintain acid-base balance. Electrolytes like sodium and potassium and bicarbonate are very closely regulated, and acid-base disturbances affect vital systems and require targeted treatments. And that's all I have for fluids, and thank you for watching.